Welcome to Maxi Life Wellness Fridays featuring valuing mental health in the workplace. Again, I'm Patricia Bermudez, your host for this event. Today, we will be joined by one of the country's most prominent doctors in psychiatry and mental health. This session will be very helpful for all of us in this pandemic, especially because the onslaught of mental health problems have been significant. We need to have a better understanding of the mental health stressors, our complex reactions, and coping at the individual, organizational, and societal level that will allow us to overcome this unprecedented challenge. Now, it's time to meet your speaker. Our speaker is the past president of the Philippine Association of the Study of Overweight and Obesity. Now, the slide will also share with you that the chairman of the Department of Psychiatry, and he is also part of the Mental Health Department at the Camino Memorial Medical Center and chair of the Physician Wellness Committee at the Philippine Airlines. Ladies and gentlemen, what an honor it is to have Dr. Ed Juan Tolentino Jr. join us for today. Dr. Ed, good afternoon.
Hi, good afternoon, Patricia, and thank you for your very generous introduction. Allow me now to share my slides. Hi, everyone. Thank you for coming over and joining us. Indeed, you value your mental health, and I hope we could elucidate how we could help each other, particularly in this very difficult time. I'd like to let you know how I appreciate Maxicare for putting up this a webinar for tonight, which actually values our mental health, particularly during times of change, such as what we are facing. This is how I intend to talk about the topic tonight. I'd like to describe what's going on, the impact of the pandemic specific to our mental health. And then for us to understand how different people react, we'd like to talk about the psychology of pandemics, where different people react in very varied ways. And of course, within the workplace, for us to be able to help each other out, we'd like to be able to pick out and identify who might be suffering from mental health problems, including ourselves, of course, and end up with a positive note talking about the strategies all of us could do in the workplace management of mental health problems. Allow me to start with what's going on in the Philippines. This is a takeoff from point from my previous talk or webinar for MaxiCare. You could see this is from the Social Weather Station's National Mobile Phone Survey on Filipino stress due to COVID-19. As you could see, Filipinos suffering from great stress has been mounting. From the May 2020 data, it was 55%. July, it went down a bit. But by October 2020, it shot up to around 58% of Filipinos experiencing great stress. So this actually comes from those Filipinos suffering from much stress, as you could see, from May 2020, 34 to 35, and then that dropped to 27%. But that actually, if you could do the math, that a lot of those came up to those who are suffering greatly from COVID-19. And those who say they suffer little or no stress have remained the same. So for us to be able to have a better understanding of stress, let me just discuss and describe to you the spectrum that we go through. From normal, hopefully all of us are starting off normal, but like it or not, on our day to day, we experience stress, either from as you go out now, the traffic, etc., the fear, perhaps the lots of things that we need to do to sanitize, but with very simple, relaxation exercises, we're able to go back to normal. In fact, some of the stress that we experience right now can be positive stress, or what we call stress, because that drives us to keep safe, that drives us to keep motivated, or to do things while we are in quarantine. However, and that's the reason why we need to talk about this stress, that is negative stress right there. And when a lot of even little stressors are occurring all about the same time, and or we don't have enough of the resources to cope with the demands being placed upon us, then we go into a distress or burnout. That's in orange because that is already a warning. From green, we move to orange to make sure we don't go into the red zone. And red zone is going into an illness or a disorder. And we could go either into physical disorders, which means, for example, if we are using coping by eating a lot, then we could go into obesity, possibly diabetes, if you have the propensity for it, or the family history, or hypertension. Emotionally, a lot of individuals from burnout might actually go into depression or anxiety, which are the most common right now being studied all over the world. And I will show you in a while. Behaviorally, some might actually make use of, let's say, sleeping pills or perhaps alcohol, and they go into either substance use disorder or alcohol use disorder. Others, because of the distress or burnout, may go into disorders which affect cognitive functionality, including memory problems, etc., or concentration problems. This becomes a disorder when it starts affecting or causing impairments either on a personal, social, or occupational level. Once we get here, then we go into different interventions, usually what we call biopsychosocial. So, including medications biologically and other psychosocial interventions to bring us back to normal. To understand also what are the factors that may influence mental health so that we could all the more protect ourselves. This is really balancing out the stressors on the one hand. These are the different demands being placed upon us right now, and it is a lot coming from, for example, the traumatic stressors, given the times of the contagion, hospitalization, for some of you having witnessed death or having heard of a close friend or family dying, the extreme exposure constantly to the details about COVID. And then living during these times, there are already general stressors which confront us on a day-to-day basis, including, for example, but not always, social isolation. I'll mention some studies on that in just a while. Employment. A lot of individuals, over 11 million, have been predicted to lose their jobs on account of the losses happening to different companies. Working from home, especially with moms, among moms with kids 12 years and below, study after study show that they are even more vulnerable and experience more stressors being a caregiver, either to kids or to your elderly parents, making certain difficult medical decisions for yourself or your loved ones. And of course, at the beginning or constantly as we go back to work, the inadequacy of PPEs. Hopefully, we could balance this out. But as you could see, there's a lot of these risk factors or stressors. We need to balance it out with our either inner or outer or internal or external resources, which comprises our protective factors. Very important, and you said it yourself, from the poll that Pat gave. Social support is quite important, and it is indeed, study after study shows it is a protective factor. Having stability and employment at this point, having enough healthcare resources, either internal, meaning you are physically, mentally healthy, as well as you have the access to healthcare, having safe workplaces. And when I say safe, again, I'm talking about physical as well as mental health safety. That you are, if you do experience any mental health issues, you could actually talk about it. Having adequate safety measures, not just PPE, the promotion of diversity, I'll talk about that even more, and the possibility of both COVID testing, and now I will add perhaps the accessibility to vaccines. This is an international study, okay, and this summarizes all the different studies put regarding what are the impacts of COVID-19 on our mental health. It's from a systematic review and a meta-analysis, a study of all different global studies which are available, and they compiled the factors. On the left, you could see the lack of infectious disease knowledge, especially when all of these started, the lack of the proper health behaviors. Remember, just a year ago, we were at a loss. Little by little, they added and added rules about safety and how we will avoid this. Of course, lack of mental health assessment and self judgment methods so that we are able to pick up earlier and seek help earlier. A lot of economic issues have been occurring not only in our country but worldwide. Of course, this causing a lot of change in sleep patterns as well as in nutrition. Amongst the young, especially prior to school opening, there was hypersomnia, which is sleeping more, and amongst those who are in the working group, they have been sleeping less. And of course, this causes a lot of problems, whether they be physical, emotional, and of course, in the context of pandemic, sleep issues will affect even our immune system. And in terms of productivity, concentration can certainly be affected. And as we have moving like going up like roller coaster up and down, we have been facing great challenges, but for most of us, we have been adapting. Others have not been doing so or have been coming up with more negative coping skills. Others have had lack of physical and mental health knowledge, the lack of psychological coping methods, which actually makes them even more prone to either physical or mental health issues. And of course, we know the impact of social media, especially having scary news, negative news, inaccurate news. Quarantine, I'll discuss that a little more, but just to take note, we are one of the countries in the world with probably the longest sort of lockdown or semi lockdown. And of course, we live in constant fear and anxiety for both our health as well as our family's health, as was actually validated in the poll. And of course, there's the constant fear of COVID 19. All of these factors have been impinging on our mental health, leading to such problems as anxiety, depression, and stress. And this was borne out by a local study which was published internationally. This is a research paper, although done cross sectionally sometime at the early part in May of last year, but reported in August of 2020. And it came out in the journal in December of 2020 on the psychological impact of COVID 19 in the Philippines. They made use of two instruments which they have been using in other international studies: the impact of events revised scale, which measures psychological trauma, and a generalized scale to measure depression, anxiety, and stress, the DAS-21 scale. And in this study, they found that 16.3 respondents rated psychological impact of the outbreak as moderate to severe. Almost 17% reported moderate to severe depressive symptoms. Almost a third had moderate to severe anxiety levels, and 13% had moderate to severe stress levels. You might say, medyo mababa. Remember, this was a cross-sectional study, so it was really a snapshot of what was going on when they did the study, and this was somewhere in the early part of the pandemic in May 2020. What did they find out as the risk factors, which we need to take consideration of? First is being female. They are more stressed out, depressed, and anxious. Being young, of single status, being a student also, having specific symptoms like being fearful of what's happening, etc., or having had previous rashes with depression, or brushes with depression or anxiety, having been recently quarantined, prolonged home stay, and that accounts for most of us right now, reports of poor health status, having unnecessary worry. Remember that even perception could be very real to an individual and can just cause the same effect. Concerns for family members, this was highlighted. Discrimination, especially amongst frontline workers, were significantly all associated with a greater psychological impact of the pandemic and greater levels of stress, anxiety, as well as depression in a statistically significant way. Next, of course, to balance off the risk factors, just as I presented earlier, there were also protective factors which we could learn from. Having adequate health information, okay? Having children who are more grown up. Of course, this is, as I mentioned in my opening spiel, women, for example, with kids 12 years and below and working from home are even more stressed out. But having more grown up children is somewhat protective. Perception of having a good health status, as I mentioned, perception by and of itself can be a good thing. So we need to feed our minds with very positive things, our perception. We can do it. Having confidence, again, something positive in doctors' abilities, were all quite significantly associated with lesser psychological impact of the pandemic and lower levels of the stress, anxiety, and depression. Those who practice good, actually in general, safety measures, hand hygiene, wearing face masks as precautionary measures, have protective psychological effects as well. You know that you are doing the right thing. And also, the restriction in social mobility to control the pandemic can be stressful and really quite stressful for a lot of us, as it prevents face-to-face connections and traditional social interactions. Now, those who go out, interestingly, this is especially amongst healthcare workers providing essential services. Because they are more exposed, they had less symptoms of anxiety, depression compared to those who were just inside the house 20 to 24 hours at a time. So just to show you, indeed, two conditions are way on the rise. We don't have specific studies yet, but in the United States, for every 100 American adults, 34 would show signs of both anxiety, depression or both. And this was broken down into 10 individuals in 100 showing symptoms of anxiety alone, 20 showing symptoms of both anxiety and depression, and 4 out of 100 showing symptoms of depression alone. And this is on the rise. Coming from the US Census Bureau as well as the CDC in a study over 2013 to 2014, those experiencing from the question, how often have you been bothered by feeling down, depressed, and hopeless? Nearly every day in dark blue. Medium blue is more than half the days. Light blue is several days, and in gray, not at all. As you could see, 76% didn't experience it at all, but 7% and the rest would have experienced nearly every day, more than half the days, and several days. Now, in just within a week, also in May, from May 7 to 12 last year in 2020, this actually expanded. Only 50% were not experiencing depression, whereas 10% experience it practically every day, more than half the days, another 10% and 30% experiencing it several days. And we know that this is occurring because of the vicarious trauma that everyone is experiencing, seeing this from the news, hearing it from neighbors or friends. Also, the grief over the different losses of life. Yesterday, the US actually marked 500,000 lives lost. The fear of the constant fear that we have of getting sick and getting really paranoid when we get sniffles. Is this it, or because we have the allergic rhinitis, we can't taste, do I also have COVID already? The unprecedented physical distancing, this continued financial concern, with us not knowing when this will really end, and causing a lot of big companies to already lay off some workers, so causing more unemployment and housing insecurity. Our loss of connection with our community, our co-workers, for students, their classmates, our friends, our families. And then, of course, reduce access to caregivers, including us doctors. At the beginning of this pandemic, patients didn't know how to get in touch with us until we had to learn in the quickest possible way how to do teleconsulting. I've been mentioning a lot about this physical distancing, economic stress, the barriers to mental health treatment, and that pervasive national anxiety which has been bothering us. This has been mentioned by no less than the Journal of American Medical Association Psychiatry as the perfect storm for suicide mortality. In fact, this is happening, and we are, as psychiatrists, are rather concerned. Some provinces have been reporting increased suicidality in their respective provinces. Further, there's this big study on social distancing and isolation. It's a meta-analysis. Again, using several studies, putting them together to power it up and to validate the results. And according to the author, Holt Lundstad, the lack of social connection heightens health risks. Hold your chairs, as much as smoking 3/4 of a pack of cigarette a day every day. That's such a big impact. And the evidence is robust. Study after study shows social isolation and loneliness significantly increase the risk for premature mortality, and the magnitude of the risk even exceeds that of many leading health indicators. So, in our workplaces, let us start picking up. Let's start with ourselves. And this was part of the poll question. How do we recognize that we are getting stressed out? Are you starting to feel irritated, angry, or in some, it's a denial? Feeling uncertain, nervous, or anxious? Lacking the motivation, feeling tired, overwhelmed, or burned out. Number one in our poll. Feeling sad or depressed, having trouble sleeping, another high number, and having trouble concentrating, which will affect productivity. However, we know that in workplaces, it might be hard, okay, to spot this. So these are some of the workplace manifestations that an employee might be struggling with a mental health issue, albeit in the pre-COVID days. But you could spot this also during work from home. Lateness or frequent breaks away from work, excessive sick leave, or being there but the brain is absent. So job absenteeism, it's also called on the job absenteeism, also called presenteeism. Reduced quality of work, the high rate of accidents, withdrawal or avoidance of social interactions or from the boss or other coworkers, increasing in employee errors, missing out on deadlines, changes in physical appearance, being disheveled, not tidying up, confusion or forgetfulness, forgetting meetings, forgetting this was discussed in meetings, etc. Having conflicts, either with other employees, with a boss, or worse, with customers. Or generally, this is reaching already proportions closer to illness or a disorder, having inappropriate behavior, certain mood swings, or having negative attitude. All of these can be added to the stress that we are all going through during the pandemic. There's the concern about the risk of being exposed to the virus at work, taking care of personal and family needs while working. This is high on our minds, especially for those going back to face working or physical work, managing different workloads. At this time. A lot of you did mention that you are burning out. Lack of access to tools and equipment needed to perform your job, especially if soon after the lockdown we were not able to take home with us the important tools that we might need to work from home. Feelings that you are not contributing enough to work, and I've heard this as I've been helping out in different companies. Some individuals feel that though they have been working overtime, they have not been contributing enough. The uncertainty about the future of your own workplaces or your own employment. Some companies, big companies, have been trying to spread out work just to make sure the company does not close up. But of course, it has resulted into employees not earning enough because they're just being paid for the days that they go to work. Then, of course, the challenge of learning
Just
new
a bit enough.
communication tools, new platforms, and of course, dealing with technical difficulties, including internet access. Okay, especially if you're working from home and you are competing with your kids, for example, or other members of the household using the internet, and adapting to different workspace and or work schedule to fit into the rest of the household's needs. Let us try to understand how so that we could help out other people in how we communicate things. Let's try to understand the different reactions. On the one pole are people who may disregard and deny the risk. They are the ones who dead ma what is going on. So despite what is being said, They fail to engage in recommendations in behaviors such as, getting vaccinated, hygienic or hygiene practices, and social distancing. On the other spectrum naman, and I think especially at the beginning, a lot of us were actually reacting with intense anxiety and fear, mostly because this came in with practically no one really knowing or putting a finger into what COVID was, how to prevent it. It was constantly changing in its manifestations. So uh, there could be some people who might, in fact, go into psychological trauma, not just fear and anxiety. And that can be debilitating because they will not even go out of their room, much less their house. So, to understand better, this is the psychology of pandemics taken from the book with the same title. And this reviewed actually this is based on reviews of all the different pandemics that has happened. So, three main factors that will predict how we react would be trait anxiety and harm avoidance. There will be monitoring versus those who are blunting their reactions, and there are those who just come up with unrealistic optimistic bias. Let me explain them very briefly just to have a better understanding. Trait anxiety, trait is you have it within you, it's your trait. Even prior to the pandemic, those with this trait anxiety view the world as already dangerous and threatening. So you could just imagine with the pandemic happening, they have been avoidance tended to be more fearful and they worry excessively. They are the ones, and there are studies now that even tease this out in more detail in terms of generations. Who are more anxious in responding to this and who are actually not taking this pandemic quite seriously. We could talk about that in a while during the Q&A. How about monitoring versus blunting? Let's talk first about the blunters, okay? Ito yung mga deadma. And the way they respond to what's going on is to distract themselves to the max na okay, mag-TikTok na lang ako o di kaya Netflix to the max hanggang Kingdom Come or minimize the threat of information. Uy, hindi totoo yan. Okay? And they don't want to listen to anything just to be able not to feel it, to blunt the emotions. And then there's the other end of the spectrum, the monitors or those who would monitor. And these individuals are motivated to change their health behaviors, but they need detailed information about the risk and risk reduction strategies. Therefore, yung risk communication, iba dun sa blunters, iba dun sa monitors. And then there are those with unrealistic optimism bias. And I could cite, for example, I will be protected. For example, yung mga nag-attend nung Black Nazarene na nawala ang social distancing, yung iba nahuhulog yung mga mask, etc. because they felt I will be protected. No? So persistent but unrealistically positive beliefs about one's future. I will be protected. Uh, let's understand, okay? According to the WHO, there are four main methods used that are used to manage the spread of infection. We've been constantly hearing the three, but let me focus on risk communication. That is public education. This is valuable in your respective companies. Okay, risk not only about the infection, but risk about the economic aspect, etc. Of course, we've been hearing a lot about vaccines and antiviral therapies, which is one of the major methods to stop finally the COVID-19, the pandemic. Hygienic practices hand in hand with the vaccine, because even though we get vaccinated, we shall continue with our hygienic practices as well as social distancing. Why am I highlighting these? Because In all of these things, psychological factors do play an essential role for the success of any and all of these methods. Let me just focus on risk communication because there's a perfect example of this. In the face of either an epidemic, terror, blame, rumors, and conspiracy theories, the distrust in authorities and panic can take hold all together and simultaneously. And that's the reason why, from the get go and constantly, we need to establish and maintain trust by giving out. And this is in organizations, in society, in our communities, in the family, honest, clear communication, which is paramount. The perfect example is Dengvaksha. We're in because of the different information and the risk which turned out, because right now it is not just EUA in countries, but it is actually approved for use. A lot of individuals did not go for any vaccination, not just for dengue, but for the other illnesses, childhood illnesses. And the result is we have more cases, thousandfold cases than we would want. So let me now go in from stress to distress or burnout. Now let me focus on mental illness. Let me just define in more laymannish terms what mental illness is. It's a disturbance from thoughts to our feelings to our perceptions. Because of this flow, the disturbance, it will affect, of course, our day to day functioning. So, in other words, thinking, mood, as well as behavior is affected, and it will be associated with distress. Remember the term. And if we reach functional impairment, then we could have an illness or a disorder, and it could be mild or moderate or severe. It is actually an equal opportunity illness because it affects people of all ages, walks of life, etc. And it does affect us on multiple levels, from the personal, social, as well as financial. If we spot, so we have been talking about picking up stress, at the back of our minds, might he also or she have a mental illness? How do we approach? If you are a manager or a co-employee or a friend, okay? These are some of the approaches or conversations that we can have. You don't seem like yourself. Do you want to talk about it? Or it seems like you're going through a tough time. How can I help? I'm worried about you. Can we talk about what's going on? Are you comfortable talking about this? If not, is there someone else you can talk to? Perhaps a friend, our boss, or perhaps the company physician who you're close to, or a relative. How can I or we, if you're speaking as a manager, support you? Do you know where you can go for help? And it helps if we know what our resources are in our company. Are you thinking, and this is an important question, you might be surprised, but it should be there once you pick up, especially the possibility of depression or a mental health issue. Are you thinking about harming yourself? Do you have a plan to harm yourself? It is okay to ask this. What you are projecting to the individual is, I will be competent enough to at least help you or talk about it should you say yes. And it is a first step to being able to save a life or prevention. And speaking of tools, of course, it helps that we have something more concrete. And I'm sharing with you something that I also share in the different companies that I am a consultant to. It's called the Patient Health Questionnaire. I choose this because it is indeed the most common screening tool to identify depression, and also because it is available public domain online. Okay, so here it is called Patient Health Questionnaire 9 because there are 9 questions, and that's how we psychiatrists uh, diagnose. But for this is just a screen. It is not necessarily diagnostic. And the question starts with, over the last 2 weeks, how often have you been bothered by any of the following problems? Zero, you score yourself, not at all. One, several days of the 2 weeks. Two, if more than half the days. And three, if you have been experiencing it nearly every day. And we go through the 9 questions. And as you could see, thoughts that you would be better off dead or of hurting yourself in some way is the ninth question. You could score 27, and usually the cutoff is 10. If you get 10 and above, it would be good to connect with a mental health resource. How about anxiety? When is it considered a disorder? As you could see, a lot of the symptoms are very similar to depression too, except for excessive worry, for example, um, uh, sleep disturb, muscle tension, okay, irritability, especially with children who are anxious, they manifest more with irritability. There's also restlessness, being easily fatigued, of course, the trouble concentrating, which it shares with depression, and sleep disturbance is also shared with depression. So usually this is over a longer period of time, 6 months. It causes distress in the daily life and, of course, functional impairment, as we mentioned. And for this, I usually suggest the GAD-7, or the Generalized Anxiety Disorder score, okay, or scale, using 7 questions, the core symptoms of anxiety, scored in the same way, okay. And this is how you score yourself: 0 to 4 minimal, 5 to 9 mild. And again, the cutoff is 10 more or less. So 10 and above, it might be helpful to seek a mental health professional. Now let's start talking about how to help others. If we are to prevent mental health, particularly, the direst and most severe consequence of mental health problems, which is suicide or self-harm, that question that I mentioned, which is asking, have you thought about hurting yourself because of that feeling of helplessness or hopelessness? Has that crossed your mind? Okay. Have you planned on it? So assess for the risk. That is actually a life saving question. Let's listen in a non judgmental way. You don't need to share your own experience because this is about the other person. What we need to give is a lot of reassurance and possibly connect them either to other resources or further information. Then, of course, if you pick up a mental health problem, you could encourage for any appropriate professional help. If they are, for example, not very comfortable, let's say you are the boss, you could simply ask, who might you be comfortable talking to? A coworker, perhaps a family member, etc., a relative, and all that. And of course, we always begin with encouraging self-help and other support strategies. Even as we help other people, usually the question is, how have you been trying to cope with the situation? What has helped? What was successful? Okay, because that becomes empowering to the individual. Oh, it turns out I could help myself. What else can be done, particularly in our workplaces? We could adopt a buddy buddy approach in which team members are paired as much as possible so that you could actually, especially during these times, if you are already working physically and you need to wear masks and all that, the only thing we could see would be the eyes. Okay, so it would be very difficult, if you don't see them. But if you're buddied up with somebody, it becomes a more effective way of actively monitoring any staff who might be undergoing some stress or even distress. Highlighted constantly, and you saw it already in the studies, social support and connection. There are studies upon studies which show good evidence for fostering cohesion amongst our staff, whether it's horizontally fostering camaraderie or vertically being closer to our leaders so that they could more easily open up. These are constantly based on studies associated with good mental health. Now, I'd also like, of course, this is a lecture all to itself, okay, to mention that in all workplaces, we have been trying to talk about psychological first aid. This is not just the only crisis we have undergone. We have undergone other crises, and we could anticipate that there will be future crises. And it helps that in companies, we have knowledge of how to administer psychological first aid. The short of it, there are three basic principles. Let's start with the first, and they are all letter L: look, listen, and link. Starting with L, we should be on the lookout, and we could start off with those whom we know or understand might be the most vulnerable, those living alone, those who have had mental health issues even before, etc. Let's be on the lookout for them. Approach them is part of listening. Remember how we presented some of the questions earlier? I noticed this or that. Is everything okay? How can I help you? Listen actively and attentively. Okay. And third, if you pick up, okay, either negative coping strategies. I've been drinking, I've been taking sleeping pills just to get myself to sleep. I've not been okay. Then it might be important to link them with the resources, and it would be important to know what these resources might be. The reality, though, okay, and we admit to this, that even up to now, there's still a lot of barriers to seeking help. Okay, there's either the internal stigma or the external stigma within ourselves. Parang, what will people say? There's evidence that it's really the stigma that relates to mental health because of perceived fears about reputation, the impact on careers, baka lumabas sa aking record yan, of developing mental health difficulties can act as the barriers to seeking mental health. Before we could start even, it helps that we have clear policies and programs in our workplaces that are non-punitive. You will not be punished just because you admitted to having mental health issues. They are preventive. So meaning we have not reached disorder, kahit nasa distress or stress pa lang, we're able to do something. It will be easier to go back to normal, and having help available in our workplaces is a good start. To speak of this, you are protected by our Mental Health Act, which was passed in 2018, Republic Act 11036, under Section 25, which is all about mental health promotion and policies in the workplace, and states that employers shall develop appropriate policies and programs on mental health in the workplace that are designed to raise awareness on mental health issues, correct the stigma and discrimination associated with mental health conditions, identify and provide support for those who are found at risk, and even facilitate access. So you don't have to have it, but at least facilitate the access uh, of individuals with mental health conditions either to treatment or psychosocial support. Now, from Republic Act 11036, the DOLE translated this into a department order number 208, which was promulgated in February of 2020, just before the pandemic. And it's a translation. These are the guidelines for the implementation of mental health policies programs for the private sector. Just a snippet, because it is 3 or 4 pages. It is mandatory now for all workplaces and establishments to formulate a mental health workplace policy and program. These programs must prevent stigma and discrimination against workers who are experiencing or at risk of mental health problems or disorders, and even provide services to address this. Employers should also promote their employees' well being as well as incorporate wellness policies in their current occupational safety and health policies. This is a list of the available free online counseling. Okay, this is constantly updated. It's important if you are going to help either your employees or your colleagues or friends or family to know, but you could easily access this online. What are, oops, what are the things that we could, for managers, what are the tips to build resilience and manage our job stress? Well, communicate with your coworkers and supervisors and employees about job stress in general. Identify things which you do not have control over. Remember, at the start of the pandemic, we lost our reign of control. So, in as we are working through this, it is important to limit ourselves with things that are well within our inner circle of control and let go of things that are beyond our control, what's happening outside, etc. And some of the things that could help us increase our sense of control is keep a regular sleep schedule. Very important because we lost that, especially at the beginning of the pandemic. Take breaks from work, especially if you're working home. Stand up every hour, okay? Within the day, put in exercise, check in with your colleagues, your coworkers, family, and friends if possible, especially now that we're loosening up, spend time outdoors, being physically active, or just relaxing in a park or perhaps in the solitude of a quiet place. If working from home, set schedules, a regular time to end your work day, okay, as much as possible. Practice mindfulness techniques, and I will just describe this because it is something that I have myself found useful and I do every single day. Do things you enjoy during your non work hours. Speaking of mindfulness, I will share with you mindfulness through rest, which is just one of the practices intended actually to help us integrate our moments of personal intimacy and awareness and integrate this with our daily lives. So the 4 pillars are which is relax your attention and then let go or release. You don't have to put any particular focus. Sometimes, in most of the mindfulness exercises, the focus could just be your breathing. So, breathe in and just think about how you're doing that. E is for exhaling all striving or emptying yourself. Let go of, all the thoughts of what should or what shouldn't be. Okay. Especially, we need to stay just in the moment. S is for having that sense of silence. Try to feel and appreciate that available head space that is silent, and surrender. Okay. Let go. No judgment in case, there are thoughts that come to your mind. It's okay. Surrender. Just notice it and move on. And T, finally, is to tune into your awareness. Trust your personal experience of being aware of things. Okay, so here I'm almost at the end of my talk. What can managers do as they build a strong remote culture? Because as of February 21, I checked, there have been already 202 million people who have received the vaccine. However, I don't know if this is bad news for some of you. Remote work is here to stay. It might actually be good news because based on a 2020 survey of 4,700 skilled knowledge workers, they revealed that only 12% wanted to return to the office full time. 72% or the majority would prefer a hybrid that combines home as well as office work. So what can we do? And I'm borrowing this from no less than the Canadian federal government. Some of the reminders: you are not working from home, you are at home during a crisis, trying your best to work. Your personal, physical, mental, and emotional health is far more important than anything else right now. And I know that you value this, precisely why you are in attendance tonight. You should not try to compensate for lost productivity by working longer hours. Remember what we mentioned about keeping the structures, keeping your reign of control. Be kind to yourself. Do not judge how you are coping based on others. Remember, our thinking regarding ourselves will determine both our feelings and our behavior. Also, you will be kind to others and not judge them based on how uh, their coping skills on you. And our team success will not be measured the same way. The metrics will change, and it has been changing from when it was pre-COVID. So how do we stay on top of that? Schedule some unscheduled time with your colleagues. Set time for coffee first thing in the morning instead of the commute that you would have done. Okay, use that for, just checking in with each other. Separate even your workspaces. This is putting boundaries. Don't use the dining table if at all possible as also your work, or don't work from your bed. That confuses the mind, and sooner or later you will be sleeping. Okay, separate also your time, your work day. Aim to have set times where you work, set times where you are truly at home. Okay, because we've lost the boundaries. And always take a digital break. Also, keep up with your physical activity. I was introduced as past president of PASOO for the study of overweight and obesity. And there, one of the things that we push for is EIM. Exercise is medicine. And at a time like this, it might be important to beef up our immune system by exercising, by having exposure to the sun, which gives us vitamin D. Stay healthy, either in terms of choosing what you eat, not using too much alcohol, maintaining your sleep health, check in with others. It's helpful to others, but also when you need help, part of social support is also asking for the help that you need. And at this time, we need to cut each other some slack. It will be a different world, so let's be kind and pass on kindness. And finally, during in a remote culture, this is what managers can do. And I'm borrowing this from no less than the Harvard Business Review. We need, as managers, to establish the vision. The pandemic actually can be seen as boon or bane. It could be an advantage if we see it as an opportunity to reestablish, or as an opportunity for reset. what wasn't working well before, what needs to be done moving forward into the future. Revisit your organizational system. You have to have clear goals and values, because clear goals and values are the springboard for any change that will happen. Perfect example, if you have a gym, because that is how you support physical exercise of your work people, okay, it might be that you need to change this. It could be a stipend for them because they are not coming to work. It could be a stipend for new sneakers, or for therapy, for example. This could be some of the more innovative ways of rethinking or revisiting the different system. Then we need to assess tools, because after a year of virtual working from home, we have seen what works and what doesn't work. And you need to ask your people what has been working for you, what helps, and what are the things that hasn't helped us. And perhaps rethink even what tools do I need to support? Perhaps giving allowances for Wi-Fi, etc. I hear claps here. I could just imagine, because some are struggling with their Wi-Fi. If you're working from home and communicating, we need to have strong Wi-Fi. Of course, we need to relearn what softwares are we using, for example, for video conferencing. Has that worked? Do we need to change our policies? And finally, we need to be empathetic to the diverse needs. For example, we need to be flexible for those who are giving care either to young children or to their older parents. We have to consider that the younger employees may have totally different needs from those who are about to retire, or the older individuals. Female employees, okay, may have a different set, okay, and we need to deal with that with greater flexibility and understanding. And of course, I will always bat for those with mental health needs. Let us be more empathetic to them and see what we could do for those suffering, especially at this time. So I'm down to my last slide. These are my takeaway points. I hope you take them with you as we end this webinar. The pandemic has had unprecedented global impact on workers' physical, mental, emotional, even economic needs. As we attempt to prevent the contagion from affecting ourselves, our families, our workplaces, and communities, we need to give equal attention to everyone's mental health. Identifying the most common mental health problems first within ourselves and then among our coworkers, okay, is a first step. But self care and caring for others is our way of preventing the parallel pandemic on mental health. Because in the new normal, resilience is not the ability to just bounce back, but the ability to bounce forward. We will not go back to the way things were. Everything is going to be different going forward. And in this marathon race, we will all cross hand in hand that finish line with new thoughts, new feelings, new approaches to the way we all live our lives. Thank you very much.
Wow. Wow, Doc. Thank you so much. That was such a wonderful talk. And that one that you said last, that will really, really stay in my heart. That you said that we're not here to bounce back, but to bounce forward. And that's a great way to end it after this wealth of information that you shared with us, Doc. And I know that we'll get you back in just a short while because we do have a lot of questions for you. Of course, we all learned so much about how our mental health is affected, especially now that we're still in a pandemic. Now we'll be able to avoid the stressors and combat those that do not benefit our mental health. I also love that he talked a lot about self-care. Ang dami kong questions, ang dami kong napulot, pero mas madami kayong questions. Nagulat ako sa listahan ng mga questions. Mahaba siya. Thank you so much to our Maxicare members. Kaya naman, you guys can keep sending in your questions as you listen to this portion where we get to tackle those questions and get our experts to answer them. Now, it's time to meet today's moderator. She is a faculty at the Ateneo School of Medicine and Public Health and a diplomat in the Specialty Board of the Philippine Psychiatry. She's a mental health practitioner of Maxicare Healthcare Corporation, and she is none other than the wonderful Dr. Joyce Maglake. Hi, Dr. Joyce.
Hello, good evening, everyone. Thank you, Dr. Tolentino. I am very humbled to be sharing, to be the one doing the Q&A with you. Uh, we actually have a lot of questions, sir, because you really had a very clear and thorough discussion. So I think, without further ado, if it's okay, pa, let's get right to it.
Yes.
All right.
Ready and raring to go. Thanks,
So
Joyce.
actually, thank you, Sir Pod. Because I think the questions reflect how much people also learn. And part of it po, I think you also discussed a while ago the culture when it comes to the workplace. Individually also that sometimes we have this stigma. Many of our participants were sort of echoing the point wherein maybe is well-being or positivity, does that mean it is equivalent to not experiencing stress? Can you please clarify this with us?
Not at all. Not and thank you for that question. It's very important to emphasize that uh, we all, and it's normal. I think I want to highlight that stress. That's why I put a check mark there. Is normal, especially the kind of stress that we are all undergoing during this pandemic. What is abnormal are the times, okay? It's the times that are abnormal, but our reactions that we are getting really stressed out is still part of normal for the most part. Let me just emphasize. So from the normal stress tayo, that's still normal, and that's why there was an arrow going back to normal. Simple things, breathing exercise, positive thinking, o di kaya go to talk to my favorite friend, etc. I'm good, back to normal. Pero kung sobra yung stress, we're not doing anything about it, or sobrang wala tayong masyadong resources to cope with it, na masyado nang tumaas yung demands, boom, okay? Madidiskaril tayo, and that leads to, kaya may broken line, to a disorder or illness. Yan ang sakit. Okay? So, kaya kinolor code ko rin, green, yung normal at stress. Nag-orange para sa traffic light lang, get ready, o parang beware. Pagka
Mm-hmm.
yellow or orange, yung distress or burnout. At red, okay, kung already a disorder. Okay? Therefore, sagutin ko na rin, Joyce, yung susunod na nakikita ko kong question, anong treatment ng stress? To be honest, kasi nga normal, hindi talaga treatments. If you notice yung sa ating sa ating graph, no, ang intervention sa sinabi ko biopsychosocial, pagka lumampas na tayo sa disorder or illness. For the most part, a lot of us do our own ways of coping with stress. And let me use that word of coping with stress. Okay? Kanya-kanya. We have our unique way. Some actually magka-quiet down lang, go to their safe space, I do breathing. In fact, bago tayo, nung nalaman kong baka umabot tayo ng 1,000, sabi ko, okay, sige, rest muna ako, magbe-breathing exercise ako. I did it and to get myself ready for this. So, we do our own thing. What has worked in the past, okay? Yung mga naging crisis mo, how did you handle that? That will certainly be helpful still right now. So that could be a starting point for us. Hindi naman dapat I know baka nami-mislead kayo kasi merong mga gamot na not no proprietary yung mga stress tab, etc. It's just a name, pero it's not a medicine for stress per se. It's really a vitamin. Okay?
Right. Opo, sir. And I think, sir, it's very reassuring that before you went here, you did the deep breathing. So even our expert needs to practice the deep breathing. So parang it really shows that stress is something that we all go through, we all experience, and it's parang how we handle it. No? Those are the things that would help us. So it's not really the absence of stress. In relation to that, po, sir, and to the participants listening, no, so we tried to combine some of the questions,
Sure.
and actually, one of the I think a very relevant question as well, because the some of the interventions that you were introducing, it seems like it needs like a sort of a change in the culture of the
Hmm.
company. Diba? So parang that's one of the questions, since sometimes there's this belief that stress is a character trait, like it's a weakness. How can we promote or change the company into something that is more geared towards work-life balance? Very difficult question at the answer.
Difficult question indeed. But siguro ang take off point ko will be from my own experience working and developing programs for some companies. For example, it talaga that's the reason why I presented my lecture or my webinar in such a way na dun sa ano ang hinighlight ko na muna, it won't change kung hindi na may pronouncement ng policy from the top. Kasi we all look towards the general policies. That's where everything else emanates. From a
Mm-mm.
policy, kung meron ng stated policy, uh, well, I could share this because that's what I do at Philippine Airlines. From we have a both drug and alcohol abuse policy, may drug and alcohol program. Meron ring mental health policy which actually halos kasabay nung ano because I was in the technical working group nung DOLE. So in advance ko na, we started talking about it. So by the time linabas ang DOLE, labas rin ang Philippine Airlines with the mental health policy and then the
Wow.
program. How do you now translate the policy into day-to-day? From there, we do training. Okay. So we have been training the different departments, particularly starting off with the middle managers. Why the middle managers? Because they're at the center between top management and the employees, and they are the ones who will be able to spot, okay, some employees who might be having difficulties, okay, with some mental health issues. At yan din ang mga prinisent ko, how to spot it in the workplaces, okay? Yan din yung mga tools na binigay ko sa kanila so that if indeed they need it, at least meron silang something concrete na, sige nga, let's do this together. The conversations, tiniteach namin how you might be able to have the conversation. And then, of course, at the end, once you pick up, para ring i-connect ko na rin dun sa rest of my lecture, yung PFA look. So if they look, they found out sino may problema, nag-listen sila, they had the conversation. Yung link is yung resources sa company. It's either me or other resources that may be needed. Kasi, for example, if it's a drug and alcohol problem, which is still under the purview of mental health, by the way, okay, we also have rehabs na pinapadala namin na libre, etc., etc. Although they go on leave muna, no? But all those resources, kung ano man ang kakailanganin, we identified what might be needed. Pwede ring mga HR. We also have, by the way, kung magka-trauma, okay, we also have critical incident stress management. Kung may mangyaring trauma outside, we will do that also. So talagang from top to bottom. But kailangan enunciate na muna sa isang policy, i-translate sa programs how that works, and then you move down to activities including training so that everybody is on the same page, uh,
Mm-mm.
little by little. I'm not saying na change na yung culture because alam naman natin na stigmatized pa rin ang mental health in the general society. So it's an ideal situation, but it is a small step forward. Little by little, we'll get there and hopefully mas readily na ina-appreciate at pinag-uusapan ang mental health in our respective workplaces.
Thank you so much, sir. Actually, your experience is really something that will guide all 2,000 of us listening.
Thank you.
Sir, so, sir, in line with that, kasi you mentioned po yung sa training sa middle managers, we actually have some questions po on how to approach rule. I think you were able to discuss actually very thoroughly po the psychological first aid and then assess, listen, give, encourage. But I think parang looking at the questions, the fear po is how do you they balance the still giving feedback na negative and then also still being able to do those without kasi the fear is baka ma-trigger daw po, baka ma-trigger yung employee.
Okay.
Do you have tips daw po, sir?
Thank you for that question. I guess that's a very, very important question. First and foremost, if I may, Joyce, palagay ko they might be worried about the big question of when you pick up, kunyari, nag-usap tayo, na pick up ko, ay depressed itong kausap
Mm-hmm.
ko, itong colleague ko, no? When you pick that up, actually it's okay. In fact, kaming mga doktor, ayun si Dr. Joyce, no? This is a standard question sa amin. And nobody jumps out our window after we ask that question. I hope that's reassuring enough. But really, on a more serious note, what you do project to the individual is that this person, by asking that question, knows, how to respond. And responding, I think that's possibly the fear, might be your fear. Paano na kung sabihin niyang yes? Okay? Will that get me into trouble? Not quite. Because yun na nga yung life-saving question. Mas mahirap kung na-pick up na depression. And by the way, ito yung nakakalungkot, no? On hindsight, maraming nag-suicide, okay, na actual, who actually either were thinking of it, were throwing signs left and right. Nobody was asking. Mas lalo silang naging desperate because nobody was helping. Anyway, years na to, in one of the companies that I'm helping, okay, I had to do psychological autopsy because something happened in their company. Interestingly, I had to interview yung workmates, yung secretary, yung building, chinek ko yung mga CCTV. You know what? For even a little over a month, he or she was throwing signs and symptoms left and right. Nag-increase ng smoking, laging nasa clinic, ang daming aches and pains na hindi mo naman ma-connect. Um, uh, Sobrang pagyoyosi nag-increase sobra at masyadong halata, nangangayayat, mukha laging puyat, from an excellent worker as in nagbaba yung performance. Ito pa ang nakakalungkot. Already told the secretary, if anything happens to me, ito ATM ko, paki-withdraw, ibigay mo sa anak ko yung pera. I mean, it was all over the place. There was an elephant in the living room, but nobody asked the question. And on that fateful day, unfortunately, sa CCTV, nakangiti pa na nag-wave dun sa reception and went straight up, and that was it. Okay? Ang sinasabi ko lang 1 month, but nobody was talking about the elephant in the living room. Samantalang kung early on somebody picked up any of those people, no, they could have already prevented this, okay, and bring him back to full functionality, full working productivity, etc., etc. So, in fact, if we weigh things, this is a more valuable question than the option of not even mentioning or asking. Okay. I hope I have emphasized that because I think if there's anything that we could to make us move forward and prevent all of these things happening, At lalo na po ngayon, medyo mabigat yung nangyayari sa atin, kaya tumataas po talaga ang mga ganitong problema. Let's talk about it. At kung ma-normalize kasi yung talk on mental health, then mas relax na pag-usapan. Yes, oo. Minsan it crosses my mind. Okay? Okay, then we could now connect to the different resources. That's why I also presented some of the resources available free pate. Okay?
Oh nga, sir. Parang that was a really useful slide. And I think parang some I might maybe to add lang po to what Dr. Tolentino mentioned. Even as psychiatrists, we don't have like the magic words to that suddenly everything will be gone.
Yes.
It's really when we ask, when we it's really the non-judgmental. Parang they know that they can open up. So siguro when they see that intention behind the person talking, that sometimes it's really what they need. There is no proper formula for it. Pero since na mentioned ni sir yung suicide rin, there's actually a question po. What if there's a social media post, kasi you're the one who saw it daw po. Still in
Okay,
the
again,
workplace.
perhaps I will also answer this based on my experience. I'm the advisor of the Youth for Mental Health, which is an aggregation of different mental health groups amongst the youth. No, actually, hindi ba napaka-active nila sa social media. Pagka sila nakaka-pick up, they immediately reach help. Sino malapit dyan? Sino ba nakakakilala nito? Sinong friend nito? So connect to the it might not be you kasi obviously social media yan, but connect to the friends. Makikita nyo naman kung somebody has already contacted, etc. And make sure that they are also dun nga sa ating LLL linked to be able to seek help or be provided help. Sa Philippine Airlines, same. Pagka yung mga managers nakita yon, they have been trained to intervene by either talking to the individual, lalo na kung may kasi may certain parang nanay tatay sila. For every stewardess may parang manager in charge, no? So they talk to them, no, find out, and then connect them with the resources. Kung hindi, yun nga, connect with the family or yung pinaka-closest niyang friends within the workplace. Okay? So always, importante kung hindi man ikaw, link. So remember the ating principle ng psychological first aid.
First aid, yes, the 3 L's po, no?
Else.
Parang, sir, I noticed po you're very active. I think some of our participants also noticed this. Kaya one of the questions po actually is more about like dealing with the multiple responsibilities, especially for those who are also parents, since they said that they have to deal with the mental health of their children as well, who are doing distance learning. Plus they're also doing their own work, so my mental health, they have to cope also, the parents. So how do you have tips upon how they can cope with this situation?
That's why I highlighted kanina towards the end yung work from home. Boundaries are very, very important. In as much as you will spend time with your kids, importante rin that you have your time for yourself. Separate your days into those, okay? Make sure that as much as kaya nga there are two ways that I've been responding to this. I also mentioned in workplaces towards the end of my talk, they should be a little kinder, more flexible, especially for women who have children working from home. Be able to address and be flexible even sa time. In the new workplaces, actually, one of the suggestions dun sa Harvard Business Review is rethink who goes at this time, etc. To make sure ang metrics magiging different. It's no longer na 9 to 5 nandun ka talaga. It's really if you are efficiently giving out your output. So yun yung mga suggestions. We really need to rethink this because nag-blur na talaga ang mga boundaries even sa house, no? Now,
Yes.
continuing with my response, isang boundary yung time, isang boundary yung space. So for example, if you know that you will be in a meeting, a virtual meeting at this time to this time, you could put yourself in your space and even put a sign or talk to the kids, okay? Speaking of which, medyo a little unwieldy to tell your kids, just keep quiet the whole day while I'm working. Impossible. So baka mas realistic sabihin nyo, you know, I have a meeting from 5:30 to 6 o'clock or 6:30. Can you be quiet within that 1 hour? Baka mas realistic pa yon. So again, boundaries. Pero realistic boundaries also. Okay, boundaries also within work time and also your me time. The only way that you could actually give your 100% sa work time is kung buo ka rin as a person. You know, you ate properly, you slept properly, you had enough exercise or connections. No, all of these things, hopefully, just to remind you, would be the things that in the new normal we'll really have to talk about in workplaces. Iba, it's going to be different, and this is the time that we can re-architecture how our workplaces will be, both in practices, in policies, in terms of tools and all that.
Right. Right. So parang sir, it's really right now it not just individually but our company as a whole, it
As a
really
whole.
has to be flexible. Parang we have to be responsive really to the times. So pero parang sometimes kasi there's like this dissonance now. We want things to go back to normal po, diba? Parang, but right now, like what you said a while ago, our reality is also changing po, no? So really quite stressful, but I hopefully all of us will parang coping will eventually come. But sir, you mentioned a while ago that we have to ensure we have me time. And there, I think that's one of the difficulties of some of our participants. I would also have to echo it as well, sir. No? In fact, some were asking, how do we, kasi apparently may mga iba sa participants natin, Doc, na napapanaginipan na po nila yung work. So, paano daw, meron daw po ba kayong tips on how they can manage yung quality ng sleep po nila?
Ah, okay. Uh, very interesting because actually sleep might be at the heart of a lot of things. In fact, I have an upcoming webinar. Nagpatalastas talaga
Ah,
on sleep, pero more focused on shift workers, no, because issue yan sa kanila. But remember, we doctors, shift workers din tayo in a way, di ba? Especially mga residents, mga nurses natin, etc. So that's very close to my heart, no? So when it comes to sleep, you're not going to sleep. Ang dami nating pwedeng sabihin tungkol that. That's a whole lecture by and of itself. And we could start off with perhaps yung pinaka-basic, which is sleep hygiene. Ano ba ang sleep hygiene? Okay? You're not going to sleep if you did not prepare yourself for good sleep. What does that mean? A lot. One, the things that you have been drinking the whole day, if you've been taking coffee, too much of it, or even alcohol. Some of you think na, oh, I will sleep by having some alcohol. Wrong. Why? Because sleep architecture is affected by alcohol, and you won't go to the deepest stages of sleep with alcohol. No, Joyce and I are in the addiction field, so medyo interest namin yan, no? Sleeping pills, no? Baka some sleeping pills, especially if it's long acting, it will have residual effects and will affect your concentration, your attention, your working memory the next day, or your processing speed. Ang bagal. May sinabi si boss, parang nakailang minutes na bago nag-connect ka dun sa sagot mo, no? So, important yon. Two, your physical space. Again, please do not work, do not eat, do not watch TV, etc. from bed. Why? Okay, to dispossess, if I go to the kitchen, tumambay ako sa kitchen ng 15 minutes, what's gonna happen? I'm gonna eat, look for food, cook food, or something related to, or drink, no? So ganun din dapat yung bed. Okay? The moment you lie down in bed, your body is conditioned to know that it's going to be for sleep or sex. Of course, adults naman tayong lahat. No? So either of those two. But not to watch TV, not to do more work. And that's the possibility. Baka you're doing work, yung computer mo nakalatag sa'yo, etc. Or even watching TV. Why? Watching TV naman or your gadgets if you are millennial or Gen Z, okay? Millennials or Gen Z, 24/7 yung gadgets nila. They don't even sa sleep, nandyan lang sa tabi. And what happens? Even that little blue light, okay, that is enough to disrupt our, daytime, our cycle, no, our cyclical rhythm, no. Iniisip ng melatonin ng brain natin na daytime pa, gising pa, okay? So you'll not really get really good sleep. And then of course, anxiety because that's number one. Fine. If really you're anxious, allow yourself 5, 15 minutes within the day, mag-max out ka ng pag-anxiety mo. But go back to mindfulness, yung pinag-usapan natin. Ano ba magagawa natin? Really, really, really. You know, there's nothing we could do about the future nor the past. But we could do something about the present. Mindful sleeping is I will lie down. I had a full day. What is the feeling of the mattress behind my back? Oh, so nice. My pillow against my head. Ay, nako. At least no work right now. Mindfulness.
Mm-mm.
This is the time for sleep. Actually, you could use mindfulness for eating if you want to lose weight. Uh, mindful eating is ano bang estado ng tiyan ko? I'm super hungry, I'm half hungry, I'm full pa. Okay, what is the food? How does it look? How does it smell? How does it taste? How does it react with my saliva as I bite into that? And then as it goes in, kamusta na? Gutom pa rin ba? Okay, konti pa, etc. That's mindful eating. So stay in the moment and relish that moment. So hopefully all of those different tips applied to sleep will help you be able to be, alam nyo ang pinaka-bottom line ng lahat ng ginagawa natin, and I've been repeating this over and over again in the context of the pandemic, is really putting back the control. Nawala sa atin ang control. The time to sleep, nawala sa atin. Yung letting go because sige isa pang episode ng Korea drama o yan ng Netflix, letting go. Hindi tayo in control. Tuloy the next day, consequence, consequence, consequence. So in all of these things, when you put structure, when you not eat on the bed or not work on the bed, when you put, I will define this as my workspace and my sleep space and my eating space, that is reining back control. I'm putting clear boundaries, structures, and eventually control. I will end with this. Every time you succeed in your every little effort, do not forget to self-affirm. I did it. I was able to, and I could do this again tomorrow and the day after, etc. We
Yes.
want to nurture new, better ways of coping. And what better way by affirming ourselves, di ba? Let's do that
Yes. Oh nga, sir, parang it's really, we have to extend kindness to
to
ourselves
ourselves.
as well.
Compassion and kindness.
Compassion. Right, right. Kasi parang we are the only version of ourselves, no?
Ourselves.
And, and to also echo yung sabi niyo, sir, I guess that's why sabi nga nila, the present is called present because it's a gift, since this is what we can control, what we have right now. Sir, actually, sobrang dami mga questions, but unfortunately, our producers are telling me that
Okay,
we're running out of time. But
sure.
on behalf of everyone, po, I would like to thank you for sharing with us your vast knowledge about mental health. I'm sure many of us here would love to attend po yung sleep webinar and all your other webinars po. So some of our Maxicare team here will also respond to the other questions that we have. So thank you again, Dr.
Thank you,
Tolentino.
everyone. Stay safe.
Thank you so much, Doc Ed and Dr. Joyce. Dr. Joyce is right. I mean, what a privilege for us to hear what Doc Ed had to share. And Doc Joyce, you did a wonderful job going through all those questions. We still have a lot of questions and we really appreciate it. Even the feedback of some people na nagtatanong, kailan na ba yung susunod? Stand by for that announcement. But to our attendees, thank you so much for participating in the Q&A and for being so overly engaged. We love it because we know that you're very concerned about your own health and you want to just live your best life. So you guys are in the right spot. You guys have been so engaging all throughout the event and we want to say thank you for that. To our Maxicare members, can we invite you now to please take a few moments to answer a feedback form after this event? But right now, we're already going to be sharing the link on the chat and the QR code on your screens. Of course, your feedback would be most appreciated. So try to take a photo of the feedback form QR code already, or you guys can copy and save the link that we have just shared on the chat. Thanks so much, everyone. Now, of course, we are ready to announce the next best thing. We are here to recognize the winners of our raffle draw, and the winners were randomly selected by our staff. And just to remind you, we have one winner that will receive a portable yoga mat, and you need that as you practice self-love. One winner who will receive a J umbrella, and another winner who will receive a mini clutch bag. Are you ready? The Maxicare team, by the way, will get in touch with you in claiming the prizes as we now announce the winners. Here they are. Let's flash them on the screen. Congratulations goes out to Angelica Maris Bernardo Navitaire. You get the portable yoga mat. Great job. And Kimberly Molina, you get the J umbrella. She is from FMC Renal Care, and from Sheraton Manila Hotel, Pauline Rontal. How are you guys doing there? You get the mini clutch. Congratulations to you. And like I mentioned, someone from Maxicare will get in touch with you guys about these prizes. So congratulations to all of you. Now, before you guys go, we have two real quick poll questions. And the first question that we always ask you, automatic na to eh. Do you want to live your best life? Yes, of course. Oo, syempre. Syempre positive tayo parate that we all want to live our best lives. So we ask these questions because it's more than just a question, right? It's a reminder that we are here to all live our best lives. And so, syempre resounding yes, of course, yan, as usual. But here is the next interesting question that I have for you guys. Here is question number 2. Which topics or activities would you like to see in our next Wellness Fridays? You can choose more than one, huh? The mind matters, maybe some connection with this discussion, preventing colon cancer, COVID-19 vaccines, how to be resilient, or taking care of the eyes. Well, ang dami namang mga iba't ibang mga topics talaga that Maxicare has put together. But someone here commented na ang gaganda ng mga topics, asking when it is. Well, with your insights here on our poll question, which we'll see the results of now, madaming may gusto ng The Mind Matters. And behind that, people also want to know about how to take care of the eyes, especially now that we're most likely strained because we're in front of the computer a lot, and how to be resilient. Ang ganda ng mga topics na mga pinipili nyo. Well, because of that, I just want to share with you that if you enjoyed this experience, please do share it on your social media using the hashtag #LiveYourBestLife and hashtag Maxicare Wellness Fridays. And you can tag Maxicare, of course, on Facebook at Maxicare Healthcare Corp. Check out their IG at Maxicare Healthcare. And they have their Maxicare Health and Wellness also on IG. Check out the address or the handle there. But you should also check out all their content at their YouTube channel. It's at Maxicare Healthcare Corporation. When looking for that particular channel, like, subscribe, and do all that. To learn more about Maxicare's products, please visit www.shop.maxicare.com.ph. And if you have questions about Maxicare's Wellness Fridays, please do send an email to Maxicare webinar at maxicare.com.ph. I saw a lot of questions asking if they can have this kind of talk in their offices. So please send out an email. Someone from Maxicare will be able to answer you there. Well, we'll see you guys at the next Maxicare Wellness Fridays, which will be on March 5, next Friday, where you learn more about moving forward with resilience. I love that topic. And it's going to be with Dr. Gia Sison, and it's at 10 a.m. Yes, you heard it right. We are back to our morning slot, ladies and gentlemen. The QR code for the registration will now be flashed on your screens. Let's flash the QR code so you guys can already register. You want to be part of that discussion? You guys want in on some really great discussion about resilience and how we move forward, katulad ng sinabi ni Doc Edna, we bounce forward. Gustong gusto ko yung sinabi niya. And of course, you should also mark your calendars already for March 12 because we will talk about COVID-19 vaccines with Dr. Edsel Salvania. Parating hit yung talk na ganito. I know you guys will try to be there and we'll be announcing soon how you guys can register. But that ends our event for today. Thank you so much for being here with us. And we hope you enjoyed and you were able to take away a lot of meaningful information just like I did. Thanks again, everyone. I'm Patricia Bermudez-Fizon, and we all know that with Maxicare, you all can live your best life. Good night.